Cars Garden Learning Fund and being hosted by the Zambian government and the Zambia National Public Health Institute. Our dignitaries are running a little late, but we don't want to be behind the program. So what we're going to do is that we will proceed with the program so that we actually don't lose out on time. My name is Mirfin Mpundu. I'm the director for ReAct Africa, Action on Antibiotic Resistance. And I know that some of you have interacted with you in different capacities as the regional lead for the International Center for Antimicrobial Resistance Solutions. Before we start, it's a tradition in Zambia that we start with a word of prayer. So I will ask Ms. Julian Nyamupachito to come and pray for us.
Good morning, everyone. Let us bow our heads and join together in prayer. Divine and merciful God, we come before you this morning as individuals dedicated to the cause of combating antimicrobial resistance, a crisis that is a global health threat. We acknowledge the magnitude of this challenge and the need for collective action, wisdom, and guidance. As we embark upon this three-day conference, we ask for your guidance to foster an environment of open dialogue, respect, and mutual understanding. May our interactions be marked by your compassion, empathy, and a shared commitment to the greater good. We also extend our prayers in a special way to those who are suffering from antimicrobial resistant infections, as well as their families and caregivers. Grant them strength, hope, and access to the best possible care and treatment. Divine God, we ask for your grace and guidance to inspire us with your innovative ideas to foster partnerships and create sustainable solutions that will combat antimicrobial resistance and protect future generations. May our collective efforts be a testament of our shared commitment to the well-being of humanity and the preservation of life. In your name we pray, amen.
Thank you so much, Julian, most appreciated. I think at the very onset, I would like to acknowledge our partners that have made this conference actually take place, and we are hoping that it's going to be a huge success. So I would like to acknowledge, and my colleague is going to move the mic. All I ask our partners, the representatives from the partners, is to just say in less than a minute what some of their expectations of this conference are. So we will start with the executive director for the International Center for Antimicrobial Resistance Solution, Dr. Chandi Sujit.
Thank you very much, Mirfin, and it's a pleasure to be here. And on behalf of the ICAS team, which we have around 8 people here, thank you once again for inviting us, and it's a pleasure to be supporting this conference. I think we are on the cusp of something very important here. The reason is that we have very limited time, obviously, but we do have the UN high-level meeting, which is coming up next year. And so some of the discussions which are going to be here, on-the-ground discussions, real people discussions, things which are happening in each of our sectors is crucial as we move forward to that high-level meeting, which is going to hopefully be a game changer in the AMR pathway. So thank you once again on behalf of the ICAS team. And we have so many partners here in this midst that it's going to be a great privilege for us to talk to you individually and between the sessions. Thank you once again.
Thank you so much. Dr. Lauren from GATP or Kim?
Hi, I'm Lauren Jankolovitz. I'm from God P, Africa. And we're just thrilled to be here and to be part of the group that is supporting ReAct Africa in putting this important conference together. We look forward to lots of engaging discussions about AMR over the next couple of days. Thank you very much.
We do have the AMR accelerator, policy accelerator. They also double as the global strategy lab based in Canada.
Thank you very much, Mirfin. It's wonderful to be here and to meet some new faces and to engage with some partners that we've worked with in the past. I'm from the AMR Policy Accelerator at the Global Strategy Lab, as you mentioned. We're kind of the new kids on the block. So for me, the main objective is to engage with you all, learn from you all. I'm particularly interested to see where countries are in their NAP development and implementation to hopefully inform our path going forward as well. So thank you so much for hosting us and having us, and we're thrilled to be here.
Thank you so much. My co-convener will be coming up shortly, Dr. Viviana Munoz from the South Center, and we will introduce our speakers from the South Center who will give us some words of wisdom. I would like to acknowledge the Director General of the Zambia National Public Health Institute, who is with us, Professor Roma Chilengi. And we are expecting, hopefully today, the PS and other directors, once they come in, we will have that official opening of the program. So real quickly, I'll give a short presentation of really about ReAct. Some of you are familiar with ReAct, and some of you may not be actually familiar with ReAct. And then I'm going to invite Professor Otto Cars and also Anna, who is the director of ReAct Europe, before Viviana comes in for South Center. Breaking our 10th anniversary. And I'd like to welcome those that have joined virtually at this point. So we've had 4 strategic areas in the last actually 4 years that have focused primarily on the national action plans. That's where we actually support countries with the development of national action plans, the costing, basic prioritization, but also some activities that I will actually elaborate on. We try to create a movement of champions around the African region, but also actually globally to address the issue of AMR. We also work on issues around global governance, where we contribute to a global dialogue. We release actually policy papers, and we are able to actually participate in many of these actually forums. We have been really excited this year with the formation of the ReAct Africa Advisory Board, where we have Professor Raila, Professor Aboderin is here, Anna, Kalin Mata, Professor Revati, Professor Lloyd Mlenga, Professor Luther, Professor Mark Mendelson, Dr. Martha Jansa-Luther-Royd, and I sit on that board. I'll just ask the board members just to stand so that we can just acknowledge them, the ones that are in the room. Thank you very much. So running quickly, I think the case has been made in terms of really AMR being a real pandemic that is claiming many lives. And I think the fact that we have millions of people dying every year from drug-resistant pathogens is actually scary. The global study that was done and published last year was very scary because it showed us that really in sub-Saharan Africa, we had 255,000 deaths that were actually directly caused or really associated with antimicrobial resistance. The challenges in Africa are quite clear. We have the highest burden of infectious diseases. We have issues around access to both diagnostics and antibiotics, but also we have situations where really AWASH programs, both in the communities and in the healthcare setting and the food systems are actually not available. These are common challenges that we see. There's been a reduction of actually funding for health in most of the African countries. We have weak surveillance systems. We don't know sometimes what we are dealing with. The coordination at country level can be a challenge. And so that is something that we get to see. The fact that AMR is a difficult concept to break down and explain becomes also very difficult for us to really communicate with patients and other key stakeholders. The lack of political will that translates into actually having budgets for the national action plans remain some of the challenges that we actually face. As ReAct, we continue to support countries in any way that we can with a policy development, with implementation, and we have a number of pilot projects that we have in a number of countries. Stewardship is a cornerstone, and really stewardship is one piece that is very, very important, a piece that is under our control. We have a number of programs, and last year we launched the Zambia Strategic Program for Antimicrobial Stewardship, ZASPAS, learning from the Strama project in Sweden. We are now contextualizing that program in the country. We believe that guidelines are key. So many times, most of us, even here, are working in hospitals where the guidelines were last developed maybe 10 years ago. And really the guidelines that are paper-based, the books, they disappear on the units. So we were able to actually pilot, develop really guidelines in Zambia, and really also created an app to make them accessible to everyone. We have had a midterm review that we did last year in December. Again, they are looking at the national action plans, being able to review them and see the progress that has been made, but also where we are actually struggling. ReAct has developed a lot of tools. You can always find them in our toolbox, where we really provide so many areas that you can use and tools that at country level can be used. We are partnering with ICAS in terms of developing tools that will streamline NAP implementation in the African region, and these tools are going to be again available. Through the JPIMR and CEDA, we are actually conducting a study in Malawi and Zambia to cost the burden of antimicrobial resistance. So this is one of the active projects, and again, it's through the collaborations that we have. We have been able to train, this year we've conducted actually training in many countries in terms of integrated surveillance, in terms of translation of research into policies, working with our partners. Under access programs, we have done a lot of work in terms of really publishing new ways to actually, give a kick to research and development, but also we have ensured that where conversations are occurring on the issues of access, whether it's with WHO, we are actually involved in those. Last year's conference, we had some key takeaways. There was the need to really increase and make actually commitments as African countries to be able to, really address this issue in an integrated manner. We talked about working together, leaving no one behind. We talked about that, we have to look at our context, and that really surveillance data that is local must be used. We talked about how we can address really sustainable funding mechanisms in the region, but also that integration of a bottom-up approach and a top-down approach. One of the key messages that the Minister of Health, Honorable Masebo, said in the meeting there was that, if community members do not understand the language that we are using, really, how can they do anything? They basically cannot do. We have developed programs working with primary school kids, working with actually tertiary institutions. We've got a flagship program where we run students for about 6 months. They meet every Saturday. We offer actually lectures across the region of Africa, and then they do graduate with a graduation. And these are students coming from all disciplines and faculties in the African region. These are our students really taking the message in the communities, using art on minbuses, talking to actually the elderly. That's what the students are actually engaged in. We have extended really our work towards the faith-based organization, realizing that the faith-based organizations and communities, engaging them again, really talking to our women group, men's group, so that we can spread the issue around antimicrobial resistance. We've engaged with the church leaders, from actually various denominations in training them around antibiotic resistance, and also to ensure that the critical role they played in HIV and AIDS can be replicated in that sense. We've been able to develop very targeted, really information, education, really materials that target, again, students and people in different sectors, those in medical schools, the farmers, communities, high schools, and also the veterinarians. But we engaged with the quadripartite in a number of really initiatives, and of course, we shall have them here. They'll tell us, some things that are happening and they are doing. We have been a strong advocate at the global level in terms of bringing the voice of the global South. Whenever we have an opportunity, we've taken that opportunity to actually bring the issues that we have in the African region. We have been having conferences since really 2014. And what that has done is that you can see the many themes we have handled. We started off actually, our ReAct annual conferences, and then we partnered with South Center, and we have worked very well. Last year's theme was really looking at the, reflections in terms of really accelerating the rate at which we address and implement national action plans. You can see the growth of this particular platform. This platform has grown. It's a very influential platform in the African region. You can see where we started in 2014 and where we are now. And in this conference today and the next 2 days, we expect over 160 participants, most of them physically, and over 100 people in terms of the virtual participation. So it's something that we have grown. And our theme this year is Leave No One Behind, advancing the One Health National Action Plan implementation in the African region. That's the dream we aspire to. We're trying to we've got some objectives. Get involved, make networks. Let's discuss the projects, the progress that we are making, the challenges we have, and how we can navigate and ensure that we create that. 39 countries are represented, and this is really something that we are very proud of. Some of the expectations, a number of you sent in expectations. You want to network, you want to share ideas, you want to learn from others. And, those are things that we hope that at the end of the conference, you will be able to say we were able to meet those expectations. The slides are going to be shared, so that shouldn't be a problem. So some housekeeping rules. Please keep your mobile phones on silent mode, and let's give each other those opportunities and respect of being able to contribute. Lunch is going to be served downstairs. Our teas are going to be on my right hand, and the restrooms are just to my right. Take another right. There are actually amenities at this facility in terms of the swimming pool, the gym, and the spa. On Wednesday afternoon, we shall have some excursions. Those who want to go and visit the mall And those who want to do a game drive, we shall do that. If you need any help, don't hesitate to see the ones with a purple color. That's the one that we are using. And with that, I really would like to really welcome you to this annual conference, and hoping that this is going to be a success. So thank you very much. We are proud to have all of you, and I'll just invite now Anna, who is the director for ReAct Europe, just to say one or two things before we listen from South Center.
Thank you so much, everyone. Thank you, Mirfin, for a really good introduction. And dear colleagues, ladies and gentlemen and friends, I would also like to echo Mirfin's word and welcome you all on behalf of the whole ReAct network to this conference. And also for, in this way, actually contributing to ReAct's work in the world and our mission to enable collective action that ensures sustainable and equitable access to effective antibiotics for all. Et je voudrais aussi dire quelques mots en français pour les pays francophones. Mesdames et messieurs, chers collègues et participants de l'Afrique francophone, soyez les bienvenus à la conférence annuelle de South Center and ReAct. Et je vous remercie aussi au nom de ReAct pour participer et pour ainsi contribuer de notre travail et notre mission de permettre une action collective qui assure un accès durable et équitable d'antibiotiques efficaces pour tous. And also for the Portuguese-speaking countries, just very quick, boas-vindas. So right now, we are in a very crucial time in the work against AMR for several reasons, and I will just mention a few. The evident one, of course, is the fast spread of very resistant bacterial strain witnessed across the world. In trauma patients in Ukraine, in neonates in India, in hospitals here in Lusaka, in the hospital where I used to work in Stockholm, and the situation is urgent. But we also saw in a time that we live in parallel crisis, ongoing at the same time. The climate change is escalating very quickly now at the moment. We also see a sharp economic slow turn in many parts of the world. Political crisis, armed conflict, also political priorities are shifting, putting national interest more at the center in several places. So, and this is happening in the time where we need global solutions more than ever. So this is a challenge, but we also see a lot of hope and a lot of positive progress in our field. And two processes ahead of us that we hear more about these 2 days that will link all the work that we do, that you do here in the different countries in Africa to the global pictures are, I'm just going to mention them very quickly. We have, as already been mentioned this morning by Dr. Sujit, a little bit more than 12 months ahead of us before the higher level meeting during UNGA in September 2024. This is the second time ever that AMR is that high on the highest political agenda. And it's an opportunity that we cannot, as an AMR community and the world, cannot miss out on. The second important process at the global level that I'd like to mention is the pandemic instrument, a core treaty. As we say in Sweden, a beloved child has many names. So this is a process where it should be like a no-brainer to have AMR as part of that agreement that will also, for the first time ever, make something binding for countries to be held accountable to. And we look already now like what has happened after the Paris Agreement. It was a big, hard work to get there. It's far from perfect and action is far from sufficient. But without this, I don't dare to think of where we would have been today, neither. So let's keep that in mind and work towards that. So we also then, because of this, have a huge responsibility, and there was something that Mirfin already mentioned, to communicate and to convey the work that we do, what needs to be done in an understandable way, and to different levels of society, to communities, to politicians, to organizations, to the private sector, to everyone. This is something that we need to do, everyone who works with AMR today. So during these coming days, we'll come back to these thematics, and I'm very happy to see this rich and broad agenda with also contributions from good partners of us like RP, ICAR's Global Strategy Lab. And for ReAct, this is also a very important occasion for us as a network, because we are something as rare as a civil society organization in focusing all our actions in this field. And we believe that movement building and engaging local societies is key to make change. And we do this in different ways, and that Mirfin described in Africa, but also in Asia Pacific region and in Latin America today. And also from ReAct Europe, we also engage in this in different manners. So we work together with farmers, with healthcare workers, and we think that, you know, linking the local needs and the challenges on the ground to the global agenda is really, really important. I think you, Mirfin, actually quite a good living example of moving between these different levels on a daily basis to make sure that voices also for lower middle countries are heard, which needs to be done even more. So, and ReAct is in a very interesting phase right now. We're reaching out to new collaborations, new colleagues, and we have a new strategic plan that we are moving onwards and upwards. And to be rooted in low and middle income countries like in Africa, Asia, and Latin America put us in a good position to continue this work and connecting the dots. So this meeting is part of that, and will help us forward to address this global challenge and to mobilize action at all levels. So thank you very much for being here today, and I'm very much looking forward to engaging the discussions. Thank you.
Thank you so much. I would like to now welcome my dear friend and colleague, Dr. Viviana Munoz. We have worked together the last probably, I think, 6 years now. She is the coordinator of health, intellectual property, and biodiversity program of the South Center, which is an intergovernmental organization of developing countries. As part of her health program, she has been working on antimicrobial resistance policy, and she holds a PhD in management of technology of the ECO Polytechnic University in Lusaka. It's always a joy, Viviana, to have you and to co-host and work together. The floor is yours.
Thank you. Let's give, first of all, Mirfin a round of applause. Well, good morning, everyone. It's such a pleasure to be back in this beautiful country. We were here last year, and as Mirfin said, very excited to move forward from all those conversations. I'll also like to note, of course, those present here from different national action plan focal points from many countries, all of you experts, researchers, students, and that's part of what makes this conference really unique, is really trying to bring together this mix of policymakers together with everyone on the ground in different sectors, in different in institutions, ministries at country level, and schools working with youth and so forth, to really advance of how do we continue to make progress on addressing antimicrobial resistance, also linked to all the other challenges that we know we need to address, because the development challenges are very much interlinked. So with that, let me tell you just a few words about the South Center. As Mirfin noted, we are an intergovernmental organization. It is only composed of developing countries. So that was the way our founders, who were leaders, prominent leaders of developing countries back in the early years, decided to establish a small institution that will work as a think tank for developing countries. And in 1995, then South Center became a secretariat. in Geneva, where we are currently based and only based in Geneva. And you may ask, well, why an institution of the South based in Switzerland? And that is because a lot of the processes and discussions at the global level take place in Geneva. And we do a New York constituency of policymakers as well, and particularly as we work closely with the group of 77 plus China and other developing country institutions. So we are more as a think tank of developing, assisting countries to amongst themselves as developing countries with the priorities of the South. So we are of the South for the South, but with a lot of intellectual independence to be able to also assist in developing policies, discussing among the South about what works best in our national context, and then helping then how do we negotiate and discuss how can our other partners in the North then also help us, and how can we address global challenges in a way that is equitable for everyone and that really addresses problems with the drivers that lead to those challenges in our national context. So South Center has a very broad approach to development problems, in the sense that we deal with many overlapping challenges, including from climate change, how do we have better taxation systems, how do we address challenges of the international financial system, how do we deal with overall issues of human rights, ensuring that we can have advancements in many other areas, including poverty reduction, and of course health being a very important challenge, and then antimicrobial resistance, one of those main threats that we have for human health, as well as for our planetary health, and that linkage between animal health and the environment. So with that perspective, I think I would say that's how we came to the topic of antimicrobial resistance. From 2014, we saw that really driving action from the ground was as important as the deliberations that were taking place in many multilateral institutions. With that, we helped also organize civil society that was already active in different countries, including the United States and Europe. And the group of Antimicrobial Resistance Coalition was established in 2014, helping coordination among those very active CSOs at that point, which was held in South Center. And from there, we've also held these regional conferences. We started in Asia, and then with the partnership with Mirfin and ReAct. And here in Africa, we've been having these, assisting these conferences as well since 2018. I'd like to say that the COVID-19, of course, put in perspective how the different challenges that we have are very much interlinked. So I think a general invitation for AMR discussion is also to always consider what are factors that we know that beyond particular AMR focused interventions also very much relate both in the perspective of the challenge, but also the opportunities to find linkages and co-benefits of the kind of actions we can take on AMR specific actions, but as well on other areas that can improve then our response to antimicrobial resistance. Secondly, I'd like to note that I think this is an important context where we are right now, in terms of there's been significant progress, but perhaps then other issues coming to the agenda or other challenges, in particular with the COVID-19 pandemic, has perhaps taken away some of the attention or some of the impetus that we had towards mobilizing more concerted and coordinated action on AMR. But I think there's a lot of positive movement, and I think particularly the presence of all of you here shows that there is, of course, a very strong commitment to what needs to be done, and what we really need to know is to learn more from each other, and in that sense, recognize we are all part of those solutions that we have to find, and we all have something to contribute. So that's part of what we really are trying to do here, is really get your inputs and help in that coordination about how can we all really help to be champions on AMR, and linked to how this agenda also supports the broader development challenge that we have in our countries. So thank you very much all for being here. And with that, I'd like to introduce just a few words from our Executive Director, Carlos Correa, who is on video. Thank you very much.
Greetings. My name is Dr. Mpundu, Director of ReAct Africa, Action on Antibiotic Resistance. Antibiotic resistance is one of the major threats that we face in this age. It claims millions of lives. It threatens the achievement of many sustainable development goals. Just the recent report, the Graham report, shows us that there was a great death rate of about 1.4 million people died in 2019 attributed to antibiotic resistance. And out of those, 225,000 people died in the African region. We know that Africa has got the largest burden of infectious diseases. Africa has many challenges: lack of running and safe water, a lack of access to common antibiotics. There is overuse of antibiotics in both the human sector and the animal sector. ReAct was established to be this organization that will catalyze action and bring this issue to national, regional, and the global front, that antibiotic resistance is an issue we should be dealing with and that needed emergent action. We've been supporting countries develop their national action plans and other national strategies on stewardship that supports this optimal and rational use of antibiotics at country level. We have supported Africa CDC and WHO AFRO, OIE, FAO, and UNEP in really establishing some antimicrobial stewardship centers of excellence in a number of countries, both in the public sector and in the private sector. We've supported the development of guidelines and treatment guidelines, which often lack in many countries. We've supported issues around access to ensure that each and every human being in the African region has access to antibiotics and diagnostics when they need them in the right quantities. And we continue to work in the areas of infection prevention and control, in promoting vaccinations and immunizations. We work with students in primary school, in secondary school, in tertiary institutions, raising knowledge around antimicrobial resistance and creating champions that will champion and who will play a critical role in addressing and mitigating the effects of antimicrobial resistance. We have been working to build a strong coalition, and ReAct annual conferences with South Center are an example where we bring experts from different fields in agriculture, environment, academia, in the human sector, and folks from the community. We continue in the global dialogue, where we bring the issues of the Global South in meetings at the United Nations with international agencies, and we sit on so many working groups under WHO and other institutions where we bring in this sort of expertise that is really needed, but also the voice of the Global South. We have been able to work in areas of contributing to research and development in terms of trying to contribute in a scientific way to diagnostics, new antibiotics. We have been very active in working in these areas to ensure that really all the folks, every citizen living in the African region can be able to have access to new diagnostics that will help our clinicians know what we are dealing with. But we've also worked in areas of building capacity. We do this at a micro level, at a hospital level, at a clinic level, including the teaching hospitals, where we have been able to establish a number of programs focusing on infection prevention and control, antimicrobial stewardship, but also integrating with surveillance, the data that that's coming out of the lab systems. We have to use this moment to catalyze our action, to regroup, find ways, learn from these last 5 years. Why have we not implemented plans? What have been the challenges? What can we do better? We have an opportunity. We can't continue losing over 225,000 people every year, and most of those are children. And I call on each one of us to work together to ensure that we use this moment to come up with ways, strategies that we can work together as the African region and address this active pandemic that is claiming so many lives
and affecting every sphere of life. Thank you.
Thank you so much, Otto. We will be able to convey apologies towards the end that our internet system has not collaborated well, but we hope that we got the gist of the message that he was delivering. We do have, I would like to now acknowledge the dignitaries before we sing the national anthem, and they come and give us some wisdom and also some perspectives that are there in Zambia. And then we shall have an official opening of this conference. So I'd like to acknowledge Dr. George Sinyangwe, the PS for donor coordination, Professor Roma Chilengi, who's the Director General at ZNPHI, Dr. Tamba, who's the Director Public Health, Minister of Health, Dr. Kalangwa, who's the Director of Health Promotion at the Ministry of Health, and Dr. Geoffrey Muka with the Department of Veterinary Services. So I will ask one of our Zambian colleagues who can lead us in the national anthem. Being away in the diaspora, sometimes you forget some of those verses. I don't want to embarrass myself. So shall we stand and sing the national anthem? Thank you. I can start, and then yeah, we can catch up. Stand and sing of Zambia, proud and free, land of work and joy in unity, victors in the struggle for the land. We've won freedom's fight, all one, strong and free. Africa is our own motherland. Passion with the place where God's good hands. Let us, our people, join us one under the sun. Oh, one, strong and free. One nation is our pride. Dignity and peace in Zambia's sky. Like a noble eagle in its flight. Zambia prays to be one, strong and free. Praise be to praise be, praise be, praise be, praise our great nation. Zambia, Zambia, praise stand under the flag of the fatherland. Zambia, praise to thee. Strong and free, Thank you so much. We may take our seats. And with that, I would like to invite the co-chair of the MRCC, Dr. Muka, who is the Director of Veterinary Services. He will give us a few words.
Good morning, everyone. First and foremost, I would like to recognize the presence of the Permanent Secretary, Minister of Health, representing the Honorable Minister of Health. I would like to recognize also the presence of the Chairperson of the AMRCC, Professor Roma Chilengi, who's also Director General of the Zambia National Public Health Institute. Let me also recognize the facilitators for this important conference, Dr. Chandi, the Executive Director of ICAS, Dr. Mirfin Mpundu, Director for ReAct Africa, Anna Sjöblom, Director ReAct Europe, Viviana Munoz, Coordinator HIPB South Center, Carlos Correa, Executive Director South Center. Let me just say, all invited guests and dignitaries. Ladies and gentlemen, the animal health sector actively participated in the formulation of the current multi-sectoral National Action Plan on Antimicrobial Resistance, which runs from 2017 to 2027. Currently, the animal health sector is part of the team that is undertaking the review of the Zambian AMR NAP. I'm glad to inform this House that the Zambian NAP is not shelved and gathering dust like many other documents, but is actively being implemented in a multi-sectoral manner with a good support from our cooperating partners, and indeed with the active participation of government itself. Ladies and gentlemen, the government through the MRCC has been working hard to mobilize resources to operationalize the NAP. And I'm glad to report that a fair amount has been given to us from the cooperating partners, some of which we really can mention here and pay. We are really indebted to their support. Some of the notable support that we've had through the Fleming Fund, the FAO, the Dutch government through ICAS, ReAct Africa, and CDC, just to mention a few, have gone a long way in implementing the multi-sector approach of AMR for this country. This support, particularly to the livestock sector, has been directed mostly towards creation of awareness, capacity building to enable AMR surveillance, both active and passive, enhancing activities for infection prevention and control at farm level, AMR and AMI data collection and human resource development using a One Health approach. We are really highly indebted as a department and the livestock sector that these activities have really taken root in the country. I would like to assure this conference that whatever we learn, whatever we are learning in the process, we are creating systems that will be sustainable when some of this support is completed. These actions effectively remove the discordance in the degree of involvement of various sectors alluded to in the concept note for this conference. To this end, I can assure you that the Department of Veterinary Services will continue with the impetus of striving to generate and disseminate evidence-based data to inform policy decisions and formulation. Ladies and gentlemen, the important feature in the implementation of our IMR NAP is that we are leaving no one behind. And we are advancing a One Health Antimicrobial Resistance National Action Plan, implementation plan within and outside our borders. With these few remarks, ladies and gentlemen, I wish you a very fruitful duration in this workshop. God bless you all. Thank you.
Thank you so much, Dr. Muka. Now we'll invite Professor Chilengi, who will give us a few remarks, and invite the Permanent Secretary to officially open the conference. Thank you.
the permanent secretary and my co-chair on the MRCC. Let me say that the co-chair has ably gone through the protocols, and I just want to respect them and say that all protocols are observed this morning, and good morning to you all. A warm welcome to everybody in this conference this morning, and it is good to see some faces again, having met them last year, and we're so pleased to have you here this morning. We agreed last year in July that together we will work out how to implement antimicrobial resistance national action plans under the One Health approach. We're pleased here in Zambia to announce that we launched the Zambia Strategic Program for Antimicrobial Stewardship, in short, ZASPAS, with support from ReAct Africa. The ZASPAS is an adaptation of the Swedish Strategic Program against Antimicrobial Resistance, or shortly STRAMA. This facilitates the implementation of the fourth objective, which focuses on the optimization of antimicrobial usage within the One Health frame. The program provides a coordination framework which aims to bring together stakeholders and partners under the One Health umbrella and cascading to provincial and district levels. The AMR National Action Plans are the core of ZASPAS. However, the implementation occurs at varying degrees across different countries. Hence, in this conference, we will share successes, challenges, and progress made in the implementation of the AMR NAPS 2.0. Zambia has made tremendous progress in the midterm revision of the National Action Plan with support from ReAct Africa, as earlier alluded to. Having revised the National Action Plan is not enough, however. We need to understand the costs attached to this, to the implementation of the National Action Plan, and the Zambian revised National Action Plan will need to be costed in order to advocate for mobilization of appropriate and sufficient resources among stakeholders that will enable satisfaction and implementation of the National Action Plan. As we all know, AMR poses a significant threat to public health and requires collaborative efforts from all stakeholders to address it effectively. The emergence and spread of resistant bacteria and resistant determinants are driven by several factors that affect human, animal, and the environment that we all share. Given the importance and codependence of human, animal, and environmental sectors, the fight against AMR requires holistic, multidisciplinary One Health approaches to move forward. I am pleased to highlight some of the successes that we have achieved as a country with support from cooperating partners through the coordination of the Antimicrobial Resistance Coordinating Committee, in short MRCC, which myself and the previous speaker have the pleasure to co-chair. Some of these successes include the operationalization of technical working groups to address the 5 key objectives in the National Action Plan. We've been privileged to ensure the terms of reference, the appointment of the members, and the initial meetings have taken place, and the technical working groups have been so charged to move ahead with their respective terms of reference, and these activities have begun in earnest since we last met. We have had the development of policy and guidance documents, which include the antimicrobial stewardship guidelines, the One Health AMR policy, the One Health communication strategy, to name the three that have been completed so far. We have also had activities in the animal sector where we had orientation of farmers on AMR in the farmer field schools. It is worth noting that the fight against AMR involves preservation of molecules for future generations. Therefore, it is critical that the communities are regarded as stakeholders in the fight, implying that we should never leave them behind, consistent with the theme of this conference this year. With these remarks, I would like to end my welcoming note and really state that it is an honor and a rare privilege to host such a good gathering that is bringing together experiences from across the continent and across the globe to share lessons learned and really galvanize on the momentum needed to push the AMR agenda forward. With these remarks, I would like to say you are all welcome, and to also say that my job here is over, except to welcome the representative of the Honorable Minister of Health, who would have loved to be here, but is represented by the Permanent Secretary. It is therefore my honor and privilege to invite Dr. George Sinyangwe, who is our Permanent Secretary in the Ministry of Health, responsible for coordinating donor-supported activities. Dr. George Sinyangwe, sir.
So good morning, colleagues. As alluded to, the minister would have been here, but she's engaged with another important activity. So I'm going to read a statement on behalf of the minister. And I'll begin with salutations. The Director General, the Zambia National Public Health Institute, who is also the chairperson of the National Antimicrobial Resistance Coordinating Committee, Professor Roma Chilengi, the Director, Veterinary Services, who is also the co-chairperson of the Antimicrobial Resistance Coordinating Committee, the Antimicrobial Resistance National Coordinator, representatives from the government of Zambia ministries, the Director, ReAct Africa, Dr. Mpundu, members of the National Antimicrobial Resistance Coordinating Committee, the Director, ReAct Europe, Anna Sjöblom, I hope I've pronounced it well, the Executive Director, South Center, Dr. Correa, supporting partners, ICAS, GADIP, and Antimicrobial Resistance Policy Accelerator, Africa CDC representative, representatives of non-governmental organizations, members of the press, distinguished guests, ladies and gentlemen, I bring you greetings from the Ministry of Health. Antimicrobial resistance threatens the very core of modern medicine and the sustainability of an effective global public health response to infectious diseases. There is overwhelming evidence that the overuse and misuse of various medicines have led to emergence of microbial resistant germs that are difficult to treat. This has resulted in longer hospital stays, higher health care costs, as well as increased mortality. Effective antimicrobial drugs are important for both preventive and curative measures, protecting patients from potentially fatal disease and ensuring that complex procedures such as surgery can be provided at low risk. The rise of microbial resistance not only makes infectious diseases harder to treat, but also increases the risk of spread, severe illness, and as earlier said, increased mortality. As a result of these observations, the World Health Organization has declared microbial resistance as one of the top 10 public health threats facing humanity currently. To just illustrate how bad this situation is, in 2019 alone, 1.3 million deaths were directly caused by bacterial resistance globally. And while 5 million deaths were also associated with microbial resistance. This was more than the number of deaths caused by HIV, TB, and malaria combined together. Distinguished guests, ladies and gentlemen, humans, animals, and plants share many similar genes which need to be combated and or prevented at national, regional, global levels through the One Health approach. The spread of resistant germs in one sector, such as the food industry, has the potential to spread to humans and to the environment. Equally, the environment plays an important role in providing conducive conditions for resistant germs to increase in number and spread. This is as a result of human and animal waste from hospital settings, for example, water sources and farms being disposed of in the environment. Ladies and gentlemen, given the importance and codependence of human, animal, and environmental sectors, the fight against drug-resistant germs requires the active involvement of all of us. A sustained global and or national One Health response is therefore essential. In tackling emergence of drug resistance, we need to work together. All of us, human scientists, plant scientists, animal scientists, and environmental scientists. To counter microbial resistance, the World Health Assembly in 2015 adopted a global action plan, GAP, on microbial resistance, which outlines the following objectives. 1, improving awareness and understanding of microbial resistance through effective communication, education, and training. 2, strengthening the knowledge and evidence base through surveillance and research. 3, reducing the incidence of infection through effective sanitation, hygiene and infection prevention measures. 4, optimizing the use of antimicrobial medicines in human and animal health. And 5, increasing investment in new medicines, diagnostic tools, vaccines, and many other interventions. Distinguished guests, ladies and gentlemen, Zambia, like many other countries, developed a multi-sectoral national action plan anchored on the GAP objectives in 2017. The goal of the plan is to ensure continuity of successful treatment and prevention of infectious diseases with effective and safe medicines that are quality assured, used rationally, and accessible to all who need those medications. A coordinated approach, as articulated in the plan, is helping Zambia to prevent emergence of resistance strains. The government, under the leadership of His Excellency the President, Mr. Hakainde Hichilema, is committed to improving the healthcare services in the country. Work in maintaining therapeutic options is part of this commitment. As I conclude, ladies and gentlemen, I wish to reemphasize the government of Zambia's commitment to fighting emergence of resistant strains and the importance placed in equitable quality healthcare for all, aligned to the universal health coverage of leaving no one behind. We all together can prevent the spread of microbial resistance. Partnerships in this work are cardinal in unlocking the barriers for collective actions. We acknowledge all the local, national, and international players in the fight against microbial resistance and pledge continued support to this cause. I thank you.
Thank you so much, the Permanent Secretary. It's encouraging to us, and we would like to again, I think, echo our sincere thanks for the Zambian government in hosting us, especially the Zambia National Public Health Institute. We will go out. I hope you're not running. We get a group photo, and then we can share some tea and coffee. We are so grateful. Thank you.